meniscal injuries, and why small decisions now could have big ramifications later. The meniscus injury is one of the most common knee injuries in all of sports. Unfortunately, the meniscus is an important structure to the knee function. The injuries to the meniscus can be alone or with other injuries like ligament injuries. There have been many high-level combat sports competitors who have recently sustained meniscal injuries, and these injuries have some interesting names like bucket handle tear. Pretty crazy sounding, right? Well, let's talk about it a bit. I'm Dr. Lucius Pomerantz, board-certified orthopedic surgeon and Brazilian Jiu-Jitsu black belt, trying to bring a unique perspective to combat sports injuries. If you like it, then like, share, subscribe. If you don't like it, please tell me how I can do better. So, back to the meniscus. Today, we will briefly talk about what a meniscus is, where they are located, what they do, what happens when they are injured, and how orthopedic surgeons deal with the injury. To talk about the meniscus, we also have to understand a little bit about the knee joint itself. I talked a fair amount about the knee and the ligaments supporting it with my heel hook video, but a little refresher as to what is relevant to the meniscus. The knee is made up of the femur, a round bone, making a joint with the tibia, a flat bone. The fibula is also involved, but not so much for this talk today. This is an inherently unstable structure. It is very dependent on the soft tissues around it to hold it together. The ligaments do a lot of work, but now I need to mention two little structures sitting on top of the tibia that do quite a lot. These are the menisci. A meniscus is a C-shaped, wedge-like, soft tissue made of fibrocartilage in the knee. This fibrocartilage is mostly water.
Now water can flow or it can crash. Be water, my friend.
Meaning it is tough but flexible. There are two in each knee, medial, the inside, and lateral, the outside. These menisci have slightly different shape and function. The menisci have very important functions that I will boil down to two main things. One, stability. Two, shock absorption. The stability is done through their unique shape. They allow the tibia to be deeper and have the flat bone hold the round femur bone better. This spreads forces out over a larger area. Because the menisci are anchored to the tissues around them, they then support the femur as it moves over the tibia. Also, because of the unique fibrocartilage structure, they literally are shock absorbers for the knee joint. Alas, the menisci have a big flaw. They have poor blood supply. Without good blood supply, they cannot heal well. The blood supply comes from the periphery, but does not make it very deep into the tissues. The vast majority, maybe even 75%, do not have substantial blood supply. The menisci are injured when the forces of the knee joint exceed what they can handle. In young athletes, this is often a combination of compression and twisting across the knee joint. Sometimes, what starts off as a small tear in an area without blood supply can then propagate through the tissues and become something quite big. Or the meniscus can get a big tear all at once. Often the forces that cause this also injure other structures, such as ligaments. Sorry, TJ Dillishaw. Alright, so the meniscus is torn. What happens? Often there's pain. There are nerve endings in the tissues. Depending on the size of the tear, the flap of tissue may flip around and get in the way of the knee joint moving normally. This is what we call mechanical symptoms and include the sensation of catching or locking in the knee joint. It is important to point out that once the tear has occurred, the function of that meniscus is compromised. If the patient is having issues, something should be done. An MRI of the knee is often used to confirm the injury, keeping in mind that only 25%, maybe 1/3 of the meniscus gets enough blood supply to predictably heal with scar tissue. The rest has limited or no chance of healing. Some meniscal tears can do okay without surgery, but it can take 6 months or more to get to a place where the patient is happy. Many professional athletes do not have that time. Surgery is often done arthroscopically. The camera and small tools are placed through small holes in the knee joint. If the meniscus can be repaired, then the surgeon will place stitches into the tissues to hold it together. If the meniscus cannot be repaired, the surgeon then just cleans up the edges so no tissue can flap around inside the knee joint. The technical components of the surgeries are not difficult for skilled sports surgeons, but the decision of what is best can be hard. If the meniscus does not heal, then the sutures will fall apart eventually, and the patient is back to having a torn meniscus. If you just clear away the torn meniscus, then there is no chance at healing, and part of a very important structure is now missing. And we know that patients will go on to develop arthritis in the knee. How much arthritis does depend on a lot of issues. Nicky Ryan summarizes the debate here. In a perfect world, the surgeons could just fix every meniscus and get it to heal quickly and predictably. But that is just not the case. A lot of research has gone into this problem, but no great solutions yet. Athletes have short careers, but hopefully long lives. We want to make sure they can return to sport and perform at a high level, but we also must consider once the athlete's career is done, and if we did a service to the athlete with our surgery. Surgery on the meniscus to clean it up or repair is a decision that is influenced by the nature of the tear, the activity level of the athlete, and the athlete's goals. It is a very individualized decision, and in professional sports, a lot can be riding on that decision. It is not often an easy decision, and I can assure you, the orthopedic surgeons want what is best for the athlete. We want you to get back to the things that you love to do. Let's keep moving.